Hi Kansas City moms, we are here today to talk all things menopause. So hot flashes, sleepless nights, weight gain, we've heard it all. They don't change from generation to generation, but the treatment does. And so we are here today with Dr. Laura Parks of Plaza Women's Health, which is a part of HCA Midwest Health.
Hello.
And we're going to talk about options for women today as they approach menopause,
Right.
as they're going through it. You know, our audience is starting to age, so it's something we're all thinking about. So how does a woman know if she is approaching menopause?
Well, the average age of menopause in the U.S. is 51. So
Okay.
as we kind of get into our mid-40s, we need to kind of start thinking about it. But it does tend to run in families. So if you know how old your mom or aunts or grandma were when they hit menopause, you'll probably be around the same. But there are definitely women in their kind of mid-40s, women in their mid-50s that hit menopause. So there is a range, but the average is around 50, 51.
Okay, and what are the signs that you might be getting closer to
Right.
start paying attention?
Yeah, so as we kind of near menopause, those kind of years kind of leading to menopause, we call perimenopause. And typically what happens is one of the first things that we notice is that our periods get a little crazy. So just like they were a little crazy when we first started having periods at puberty, they get a little crazy again.
Okay.
So they can get heavy, they can get more frequent, closer together, longer. So definitely we notice this change because they've been hopefully fairly consistent up until then, and then all of a sudden it's this new kind of change with the period. So that's one of the bigger things before like full-blown menopause happens that we notice.
Okay. And so I feel like if you haven't been through it, my impression of menopause comes from like movies.
Right.
Of the, you know, older women starting to sweat and,
Right.
you know, turning down the thermostat.
Yeah.
So what is menopause really like?
You know, that also varies with women. You know, there are the women who they sweat through their clothes, their hair gets, you know, wet from sweat, turn bright red, and a lot of women describe it as like starting this deep burn from the inside that kind of flares out. And so that's what a lot of women do experience. The frequency of it can be different. So some women have it every hour or a couple of times an hour. Some women it's a couple times a day. Other women are lucky and just have like, you know, they just kind of feel this warm sensation, but they don't have the overall soaking through the clothes during the day, which can be disruptive with work and, you know, if you're out with your friends or your family or those kinds of things, it can be really upsetting.
Yeah.
But also not being able to sleep at night because you're waking up burning hot and then you break out in the sweat and then you're cold and then you're hot and then you're cold. So not sleeping well, which affects our moods and everything else. So it really kind of compounds and can get worse and worse.
So how about some of the other symptoms we talk about, like lower metabolism or painful sex?
Yeah.
Talk about some of those.
Yeah, so metabolism definitely decreases as we get older, unfortunately. It makes it more difficult to lose weight, certainly, and even more difficult to just maintain weight.
Okay.
So women who are like, I haven't changed anything in my diet, I'm watching what I eat, I'm exercising, but I'm still slowly creeping up in the weight. That's because it's just even harder to maintain as our metabolism starts to go down. And there's not a great answer for that, unfortunately. I wish that there was. But some of the things that I talk about is, or with my patients and think about for myself even as I'm getting nearer to that point, but making sure that we're active as many days of the week as we can. You know, I'm a big follower of my rings on my little watch to make sure I'm getting my steps in, I'm, you know, getting my heart rate up at least 30 minutes a day, most days if I can. And then what we eat is important. And, you know, I used to be able to eat that half a box of Cheez-Its, you know, as a snack when I got home from work.
Like.
Cheez-Its are my weakness.
Yes.
But now I have to really kind of watch my portions and
Yeah.
watch my carbs. I think as we get older into perimenopause and menopause, carbs are not as friendly to us, and you know, when our metabolism is decreasing. So trying to think about healthier snacks that are still, you know, yummy and satisfying, but maybe not all carb, which is sad to me because I do love Cheez-Its.
And how about the painful sex? Is that another
That is a
thing
big
to expect?
problem for women
Okay.
because, you know, want to be satisfied, you want to have a good relationship with your husband or partner or whoever, and it's not fun if it starts to hurt, and it can affect your relationship even, and
so why is that? What's happening?
Yeah, so what happens is as we get closer to menopause, our estrogen level starts to drop, and once we hit menopause, that estrogen level is quite low, and estrogen is what gives the vagina kind of that natural moisture and that elasticity so it can stretch and so it doesn't get these micro tears which then really hurt and burn with intercourse. And so there are definitely some treatments. Do you want to go through those now? Or?
Yeah, sure.
Okay. So one of the easiest things that you can do, and you can just run to Target if you don't have it at home, but I love coconut oil. Coconut oil is wonderful. You go get the more solid form that's like Crisco in the baking aisle. You can use it daily, just with like your own kind of hygiene and showering and that kind of stuff as a natural moisturizer for the vulva. But also it's great with intercourse, so it's a great natural lubrication. It's pH neutral, so it won't cause any infections like yeast or bacteria. And it truly won't cause any stinging or burning, and it'll just kind of absorb into your skin. And it smells great, so you're like on vacation.
Right.
So,
just at the beach.
Yeah, you're just at the beach, but it's great for intercourse to help, just increasing that kind of natural moisture, and then also as a daily moisturizer. But if that's not enough, and it may not be, you can talk to your gynecologist or family physician about doing something more prescription-wise, which would be a hormone. We can do vaginal estrogen cream or tablets, those kinds of things. And just localized estrogen to that area can really help with that elasticity and moisture. And it's really low risk because it's very just localized, so it's not affecting your risk of breast disease or breast cancer or heart disease or any of those things. So just locally treating it. So I usually like to start with coconut oil. If it's not enough, then have that conversation with your doctor about a prescription for estrogen.
And so how long do women experience these symptoms? Like, is this something that's temporary thing or for the rest of their lives?
So again, it's variable. We're all different. Everybody's body is different, but on average, women, when they hit kind of in that perimenopause to menopause, we have the hot flashes, night sweats, difficulty sleeping, mood changes for about 2-ish years on average, and then the hot flashes usually start to dwindle or space out. Which then help with the sleep and all of that. Right. Some women do have them sustained longer than that for years, and those may be ones that decide to talk with their physician about, more systemic treatments for those types of things. But most women, they can know that it'll probably be like that for about 2 years.
And then you'll find like a new.
Then it'll kind of
post
slowly get better.
Okay.
Exactly.
So do we need to get our hormones checked as we're going through this?
That's a great question. I usually don't check hormones for women. I am a really strong believer in seeing how the woman feels and listening to her symptoms, because that's really what we want to treat. We want to treat the symptoms, not a number in a lab.
Right.
My number could be the same as your number, but I could have no symptoms and you might feel terrible. So we want to treat how you're feeling. So I usually kind of titrate medicines and options based on how the woman feels and what kind of sleep she's getting and the hot flashes and all of that, rather than a number. We certainly can check them. If I have a patient who's very curious and just wants to know, we can check them. But I really wouldn't treat an abnormal number if the woman was feeling very well. Vice versa, if she had normal numbers but was feeling terrible and not sleeping and having hot flashes, then I would offer treatment. So
got it. Okay, so women start out on this kind of, most of our lives are on this yearly schedule with visiting our OBGYN, and then pap smears, I guess, is now every 3 years. And then mammograms get added in. So what does your care look like during and after menopause?
Sure.
Do you still need those annual visits, and what tests do you do?
Yeah, that's a great question. So I recommend for my patients to still come and see me or another gynecologist or family medicine, internal medicine doctor that does pelvic exams once a year. So we can space out pap smears if they're normal, and once you're over 30, they can even be spaced out to every 5 years if they're normal. With HPV testing, that's normal. But we still want to have an exam. Someone needs to examine the vulva to make sure there's no skin lesions. We can get dermatologic things on the vulva, even skin cancers that nobody else really looks at. Someone needs to be checking those ovaries, making sure that they're behaving and not getting enlarged or any issues in that way.
Okay.
And then a breast exam. So once a year with a gynecologist is recommended. But the pap smears we don't have to do as frequently.
Okay.
And then for mammograms, we still recommend them yearly. And there's not really a stop date on that. It's more keep doing them every year as long as you would potentially do something with the results.
Right. Okay. So do we miss any treatments? I mean, we talked about, for the painful sex, or I guess treating hormone imbalances. Is there anything else that you can do to help ease?
Yeah, so there's a couple of different options for women who are having these symptoms of menopause. So the hot flashes, night sweats, mood changes, feeling fatigued, all of that. And so there is systemic hormones that we can give, so estrogen and progesterone.
Okay.
The estrogen is what treats the hot flashes and night sweats and makes you feel back to normal,
Right.
or pre-menopause.
Right.
But that does have some risks, and some women are candidates for that, some women aren't, some women don't feel comfortable with it, but it's an option to talk to your physician about, because it really will make all the symptoms go away pretty much. But for those women who aren't candidates for it because of health issues or family history, or just aren't comfortable with it, and that's fine too, there's a couple of other options.
Okay.
So there is another prescription, but it's non-hormonal, and that's a whole class of medications. They're the SSRIs, which are like the antidepressant anxiety medicines, but we've had studies of them, and they actually help to decrease hot flashes, night sweats, and thus help with sleep and mood by about 60 to 70%,
Wow.
which is enough for a lot of women,
Yeah.
especially for women who can't or are uncomfortable with hormones. That can still give you a lot of relief to get through your day, to get through your night, and to keep living. So that can be a good option.
Okay.
And then there are some people who don't feel comfortable with that. And for those women, there's also some herbal medications that there are some that have been studied and seem pretty safe and have been around a long time. There's some new ones that we don't have a lot of data on to know if they're safe or not safe, or work or don't work. But some of the over-the-counter ones that we know do work better than placebo. So there's black cohosh, and there's evening primrose, and there's even one called false unicorn, which is my favorite name. It looks like a little unicorn horn. But some of those
Good
are
marketing.
some of the herbal things that can help women. And the studies, when they looked at them, they decrease hot flashes and night sweats by about 40%,
Okay.
which is a little bit over placebo effect, and
Okay.
that may be enough for some women and get them kind of through that hump to where they're feeling better. So it's nice that there's different options, because some women might feel comfortable with one option, some with another option, and then there's a couple, there's just different things.
So then, kind of speaking to the supplements, it seems like that's a frequent commercial and ads we see popping up on social media, or maybe just my social media, I don't know. But of different supplements or things that will help. How can women evaluate, or should we be skeptical, or at least discerning about some of those ads that we do see?
And that's tricky, because there are so many things out there, and there are always new products coming out, and supplements and all of that. And the tricky thing that sometimes will make physicians or healthcare professionals feel nervous about is that they're not really studied by the FDA, so they don't have to go through that same process as like a prescription medication. So we don't always know, and a lot of times even if patients bring me what the samples are, the supplements, I don't know, because they haven't been studied.
Right.
So it can be tricky, and it's just kind of doing your best with reading about them and all of that. And so, but there are some that have been studied, so even though they're supplements, they've still been studied, and we know that we know that they're safe. There's others, we don't know that they're not safe, but we don't know that they're safe. We don't know that they work, we don't know that they don't work. It's just more of an unknown. And it's tricky, and even when I'm looking at them for myself or my family, you just don't have that information or data.
Right. Okay. All right. Well, anything else we missed that you think women should know as they enter that phase?
Yeah, I think women should know that all of the symptoms that they're feeling are normal, but they're not great. So, and there are treatments for them. They can feel better, but they shouldn't feel alone, like they're the only person having those symptoms. So you know, if they talk to their, you know, friends, if they're around the same age, or their moms or sisters or aunts, they probably had a lot of the similar symptoms or problems, and you know, we all eventually go through it or have gone through it, and so I think just kind of normalizing it and talking about it more, and especially, you know, the depression or the mood changes that can sometimes come through it, a lot of times because of the lack of sleep from the hot flashes and night sweats and not being able to get good sleep. You know, we don't talk about that enough, and so I think, you know, talking about it, you know, with people that you feel comfortable with, bringing it up with your physician, your gynecologist, you know, because maybe if you're having some of the mood things and the hot flashes, maybe one of the SSRI medications might be better for you to get both of those things rather than the hormones. And you know, there's just a lot of different options, and just to not assume that nothing can be done and suffer through. You know, we have a lot of great options to make it much better, because women are younger and younger as they age and more active. You know, like 70's the new 40, you know, like
so.
Everyone is active, and you know, it's great, and you don't
Yeah.
want to feel like you can't do the things that you want to do. You can't, you know, watch your kids grow or your grandkids grow because you're feeling so terrible. And so just, you know, come talk to us. We can talk about all the options. You know, I understand that women might feel comfortable with one thing or not the other. We can go through everything with kind of all the risks and benefits and all of that. So
Yeah, I think that's great.
Yeah.
That we just don't talk about
a
a lot of things about being a woman, but
Exactly.
this is definitely something that.
Exactly. And then also, if anyone's interested,
Yes, I'm just gonna.
we do have this really great thing here at Monora coming up. It's this Saturday. It's from 8 to 10 if you come into Entry C, and it's the Women's Wellness Event. We will be there with our group, many other physicians, women's care physicians who specialize in cardiology, breast health, OBGYN, weight loss, and more will be there. There'll be lots of vendors. There's going to be even, I think, some yoga and different things, so it's going to be really exciting and fun. So I'll be there. I hope to see you. It's going to be awesome. So 8 to 10 this Saturday at Menora.
So this Saturday.
Yeah, this Saturday.
All right.
We can talk more about menopause if you want. We can talk about whatever you want. So
awesome. We'll bring. You can give your favorite coconut oil brand.
Yes, I love coconut oil. It's amazing.
Great. So whether your daughter is going through her first period or you're reaching menopause and need to discuss,
it could be happening at the same time.
It could be. So they can come see you, and all the other specialists at HCA Midwest Health, and get you through all those things about being a woman and a mother, and they're here to help.
Taking care of women and girls from infancy to beyond. So,
well, great. Thank you so much, Dr. Parks, for your
thanks for
time
coming
and
to talk to me.
bringing this to our attention and really getting women talking.
Definitely passionate about women's care and helping women, whether they're girls, teens, you know, women in their 20s, 30s, or women in menopause, helping you to be your best self and live your best life.
Awesome. Thank you so much.
You're welcome.